Hi, my name is Murray. I'm a registered nurse in Parksville, British Columbia, and I've acquired the Cynosure's Viasure machine, which is a shockwave therapy machine, and it's used for erectile dysfunction as well as multiple different musculoskeletal injuries and problems. It's very good for plantar fasciitis, for golfers' elbow, tennis elbow, shoulders, rotator cuff injuries, hips, ankle sprains and strains. Today we're going to be focusing on showing you what a typical musculoskeletal treatment would be with plantar fasciitis on a real patient. And we're going to examine her foot, see where the problem stems from, and then treat her with the shockwave machine. Typically, I would like to know if the patient's had any imaging done prior to doing any treatment. There's a few situations where we don't want to be applying shockwave therapy. If there's cancer in the area, if there's a growth plate in the area of treatment, but typically there's only a couple of issues that we don't want to do. We don't want to apply shockwave therapy over a hollow organ like your bowels or your lungs because they can cause a little bit of trauma in the lungs or the bowel. That's pretty much the only reasons why we wouldn't apply shockwave therapy. So our patient has had imaging. It's showing some inflammation in her right bottom of her foot, in the plantar area of her foot. So we're going to apply the shockwave therapy to her foot. And the settings on the machine vary depending on what the situation is. Okay, so we use the same ultrasound gel that they use for ultrasound machines, and it's required because this particular machine, there's two types of shockwave. One is called radial and the other is called focus. The radial shockwave is more of a mechanical system. The focused is more of an electrohydraulic system, so it transmits a sound wave through a hydraulic fluid, through a membrane, and through the gel into the tissues. So we're going to apply some gel to the bottom of her foot, which is heated. I don't like applying cold gel to anybody. It's not very nice. Okay, we're going to apply a shockwave treatment to my patient's plantar fasciitis that she's been suffering from for months and not able to get rid of it. Typically, you would do one treatment every week for 3 to 5 weeks, depending on how bad it is, and then it'll be all better. And then we'll talk a little bit afterwards about preventative, because this will treat it, but you need to prevent it from coming back. Is that better pressure?
Yeah.
What's it feel like?
Well, it felt one way until we got here, and then it
Yeah, I think
changed.
you've got some inflammation up into the heel, and that's typically where you'll find plantar fasciitis hitting.
Yeah.
But it can be anywhere along the bottom of your foot.
Right.
But I suspect you've got a little bit of inflammation in there too, so this will
Right.
help to reduce the pain, the swelling, and
Right.
get rid of it.
And it's not painful. It's like
just it's a
snapping with an
elastic band.
Yeah. That's what it's like.
It's just kind of a minor discomfort.
Okay.
Yeah. Okay. Ready?
Yeah.
And I do want to treat the back part of your heel here.
Okay.
It's not painful, just ticklish, isn't it? It sort of stimulates what we call the Babinski reflex. So when we're checking your reflexes, that's what typically happens.
Yeah.
Okay, go.
Oh, it's such a strange thing to like describe.
Yes.
Like, I don't know. I don't describe it as painful though.
No, it's not
It's-
painful. It's just a very strange sensation.
Yeah.
Typically what patients tell me afterwards is that the pain decreases. Now, because we're stimulating the immune response, an inflammatory response, because that's how the healing takes place, you can get a bit of a flare that night of increased pain, but typically it drops off the next day quite significantly. And one treatment every week for probably 3-4 weeks is probably going to be fine for you.
Right.
Okay?
Right. But it varies depending on.
It does. It varies depending on the severity, the location, what system we're treating. Because what it does is the pulse penetrates the tissues into the cells. It stimulates the cells because of their receptors. They sense this pressure. And so what they do is release growth factors, healing factors, stem cells to proliferate the growth of new blood vessels and smooth muscle tissue, striated muscle. And it stimulates repair of ligaments and tendons and muscle tissue, and it just decreases inflammation over time. So after the treatment, the one thing that's super important, because we're trying to stimulate the system to cause inflammation, we don't want to take any anti-inflammatories. So no non-steroidal anti-inflammatories. We don't want to take ibuprofen, Aleve, Celebrex, any of those NSAIDs for 24 hours post-treatment. No ice for 24 hours post-treatment, because what you're doing is stopping that whole process and you want to get the benefit of it. But there's no downtime. You can carry on and do what you normally do. The only thing I advise people with musculoskeletal injuries is no strenuous exercise for the first 24 to 36 hours. So don't go to the gym and start jogging on the treadmill.
Right.
So just give it 24 hours and then you can carry on.
Perfect.
But no downtime typically. So whether you suffer from elbow injuries, plantar fasciitis, erectile dysfunction, you can give us a call at Elegance Sculpting, or you can visit their website at elegancesculpting.ca, or my website at fix-ed.ca to discuss your treatment options. Just because you live with pain doesn't mean you have to.